Medical science advances every day, but there are real cases that leave even the experts perplexed. Situations so strange that they seem impossible, as if taken from a movie. So, get comfortable and turn off the lights, because these are 7 mysterious cases of medicine. How are you? Good morning, afternoon, or evening. Let's begin. Jean Hilliard, the frozen woman. It was the night of the 20th of December 1980, in Langby, Minnesota, when Jean Hilliard, a 19-year-old girl, had a terrible accident. Her car overturned in the middle of a snowstorm and became trapped. Unable to start it, she decided to get out and walk through the blizzard with only a coat, a pair of gloves, and cowboy boots. That night in particular, the temperature reached 30 degrees Celsius below zero. The woman walked in the dark, remembering that she was about 2 miles from the home of a friend of hers named Wally Nelson, but the weather was so extreme that she barely had visibility, making her walk practically a suicide mission. After walking through the snow for a couple of kilometers, her body could take no more, and exhausted, she collapsed just a few meters from her friend's door. The next morning, when Wally left his home, horrified, he found the frozen body of the woman under the snow. She was frozen, yes, but inexplicably and surprisingly, Jean was still alive. Fortunately for her, her friend Wally realized this and, as best he could, dragged her inside his home to try to shelter her. Afterward, he asked one of his neighbors for help to take her to the hospital. Due to the weather conditions and the distance, waiting for an ambulance would have meant losing even more time. I thought she was dead. She was as rigid as a board, but there were bubbles coming out of her nose, Wally declared to the media some time later. Her body was so frozen that, according to the neighbor, when they carried her, she felt like a piece of frozen meat. Once at the hospital, the doctors could not believe what they were seeing. They had never encountered such an extreme case of freezing. And for that point, any other human being would have already passed away. Still, without precedence, they acted to try to save her life. It is said that when they tried to give her an injection, the needle broke against her frozen skin. They could not record her pulse, nor her blood pressure, but they knew she was alive because her open, glassy eyes still reacted to light. When they finally managed to take her pulse, it was only 12 beats per minute. To put it in context, normal figures for a person are between 60 and 100 beats per minute. Her body temperature was so low that the thermometer could not even register it. After several hours, with the help of thermal blankets, heating pads, and extreme care not to damage her tissues further, Jean began to react. When she came to, the first thing she did was mumble with difficulty, asking about her father's car, which had been trapped in the snow. From that moment on, her recovery was faster than any doctor could have imagined. In a few hours, she could speak clearly and was perfectly oriented. She showed no memory loss or neurological alterations, something that strongly caught the attention of the doctors, because after remaining for 6 hours in deep hypothermia under the snow, brain damage should have been inevitable. Initially, doctors noted that it was almost certain that she would have to undergo amputations due to the freezing. Her fingers, for example, were rigid, dark, and without apparent circulation. However, as the days passed, the skin coloration improved, blood vessels recovered flow, and the tissues showed no necrosis. So ultimately, Jean did not lose any part of her body. She remained hospitalized for 49 days at the Foston Hospital. Her kidneys, liver, lungs, and heart functioned normally. The hypothermia did not manage to damage them. Doctors compared this case to that of other people found in similar conditions that same winter in the United States. Most had died despite having been exposed to the cold for much less time. When she was discharged, the only sequelae were some numb fingers and small blisters on her feet, minor injuries that disappeared over time. She did not have any further complications derived from that episode, and years later, Jean recounted her experience and thanked the doctors who assisted her. She also thanked the quick reaction of her friend and neighbors and the support of the entire community. She noted that many people in the town had been praying for her during her stay in the hospital, and she always believed that those prayers had been part of her recovery. The case was documented in medical media and the press, and is still studied today as a phenomenon of accidental hibernation, where extreme cold drastically reduces metabolism and, in exceptional cases, allows survival in situations that would normally be fatal. In the words of the doctors themselves, what happened to Jean remains one of the most extraordinary episodes ever recorded by medicine. The voices of A.B. in the winter of 1984 inches London, A woman whose name has been kept anonymous began to experience a series of events so strange they seemed taken from a Stephen King novel. A.B., as she was named in the article where her case is recounted, was a married housewife with healthy children and, until then, no significant medical history. She was reading quietly in her house when suddenly she heard a voice inside her head that was not her own. It was not a murmur, but a clear and serene voice that said, "Do not be afraid. My friend and I work at the Great Ormond Street Hospital for Children, and we want to help you." The phrase was so specific that the woman shuddered. She had heard of that hospital before, but had never been there. At that moment, the woman was very worried and thought that maybe she was starting to lose her mind. But after a brief silence, that voice in her head spoke again. "For you to trust us, we will tell you 3 things that you do not know, but that you will be able to verify later." The 3 facts they revealed to her were the number of beds at the Great Ormond Street Hospital for Children in London, the name of a Buddhist temple in England, and the name of a street where she could find that temple. A.B. later verified these facts and discovered that they were totally correct, although she had not known them previously, nor had any way of knowing them. A.B. immediately went to her doctor to tell him about the situation, and he referred her to a psychiatrist named Ikechukwu Obialo Ioni, who diagnosed her with functional hallucinatory psychosis and prescribed medication, in addition to brief therapy. To her relief, in a few weeks the voices ceased, and, seeking to get away from her routine a bit and trying to forget all that, she went on vacation with her family, thinking that it had all been just a strange, isolated episode of hallucinations. She did not stop taking her treatment, but even so, the voices eventually returned. This time they were no longer reassuring or cordial, but insistent, even alarming. They told her with great clarity the following: "You must return to England immediately. Something is wrong in your head. You need medical treatment now." In addition, the voices gave her an address that she did not know, with a street and number, which she wrote down on a piece of paper. Altered, she returned to London and convinced her husband to accompany her to the address the voices had given her. When she arrived there, accompanied by her husband, who until then kept thinking that everything was a product of her imagination, they discovered, astonished, that the address corresponded exactly to the computed tomography unit of a hospital in London. Once there, the voices returned and were even more concrete. "You have a brain tumor. The brainstem is inflamed. Request a scan." Her psychiatrist, upon hearing this story, tried to calm her down. There was no medical reason to suspect a tumor. A.B. had no headaches or vision problems, nor seizures or any other typical neurological symptom. A brain scan was an expensive procedure and did not seem to have clinical justification. Even so, to try to calm the patient's anxiety, the doctor decided to request the test just to show her that it made no sense. Initially, his request was rejected, as the radiology unit saw no reason to authorize the exam, but the persistence of A.B. and the pressure of her doctor managed to get her an appointment. The first study carried out in April 1984 showed a suspicious image. A second study was then ordered, this time with contrast, in May of the same year. There, something as disturbing as it was unexpected was revealed. A large mass occupied the left frontal region, extending to the right side. Everything pointed to a meningioma, a generally benign brain tumor, but which, due to its size and location, could become fatal if not removed. The neurosurgeon in charge, surprised by the total absence of clinical symptoms in the patient, met with her and her family, explained the gravity of the situation, and proposed immediate surgery. The most curious thing is that, according to the patient herself, the voices that had previously been so insistent now remained silent, as if they were somehow giving their approval to the procedure. The surgery was performed in May of '84. For hours, the surgeons worked to remove the tumor, measuring approximately 6.5 by 4 centimeters. The surgery was fortunately a complete success. Perhaps the most surprising thing about this story is that when A.B. woke up after the surgery, she heard those voices inside her head again. All they said was, "We are glad we helped you. Goodbye." After that phrase, she never heard them again. As I said, this story seems based on a novel or a movie. However, the case was published in the British Journal of Psychiatry. The doctors concluded that it was a unique phenomenon, hallucinations that were not only coherent and structured, but provided verifiable information from the real world and, ultimately, saved the patient's life. A.B. later narrated her story at a conference where some members of the audience even suggested that perhaps it had been a benevolent psychic communication from extraterrestrials or even angels who came to help her. The more skeptical believed that perhaps her brain somehow realized the tumor existed and invented these voices to be able to help itself, something that, if true, remains tremendously surprising. Gloria Ramirez, the toxic lady. This is probably the best-known case on the entire list, but we could not leave it out, as it is one of the strangest medical cases ever recorded. It was the night of the 19th of February, 1994, when paramedics arrived at the home of Gloria Cecilia Ramirez, a 31-year-old woman, mother of 2 children, and infected with quite advanced cervical cancer. Gloria was struggling with nausea and palpitations. She was breathing slowly, a sign that her body was at its limit. They took her to the Riverside General Hospital, where she entered the emergency area at 8:15 p.m. with shallow breathing, rapid heart rate, and almost total confusion. The medical team acted without losing time. They administered sedatives like diazepam, midazolam, and lorazepam to try to calm her arrhythmia. But when she did not respond to the treatment, they tried to defibrillate her. It was at that moment when the environment took a completely inexplicable turn. Gloria's skin began to cover with an oily sheen and gave off a very peculiar scent, a mixture between garlic and something fruity that seemed to come out of her mouth. Nurse Susan Kane drew blood with a syringe and perceived a smell of ammonia so strong that it made her shudder. In addition, she noticed yellowish particles floating in the blood sample. This was so unusual that the nurse immediately took the sample to the resident doctor, Julie Gorczynski, who observed it, only to collapse seconds later, falling to the floor with violent seizures. Behind them, respiratory therapist Maureen Welch also fell abruptly into the middle of spasms, and so chaos was unleashed. The staff began to faint one by one. Everyone showed the same symptoms: nausea, difficult breathing, and generalized discomfort. The patients and staff were evacuated, some taken to the parking lot, and after 45 minutes of CPR and defibrillation without success, Gloria Ramirez was declared dead at 8:50 p.m., victim of renal failure due to her terminal cancer. Meanwhile, 23 emergency service workers became ill, 5 were hospitalized, and Dr. Gorczynski ended up spending 2 weeks in the intensive care unit with complications such as hepatitis, pancreatitis, and necrosis in her knees. The possibility that all this was caused by mass hysteria was considered, but the seizures and severe physical symptoms tilted the balance toward the inexplicable. The California Department of Health interviewed 34 staff members. They found that the most affected were those who worked directly with her, handling her intravenous lines, being less than a meter away, and with a clear predominance among women. However, everyone had normal blood tests after the exposure. Faced with the confusion, they formed a team with the Lawrence Livermore National Laboratory, which published in Forensic Science International the most coherent explanation for this case to this day. Gloria, desperate for the pain, had used dimethyl sulfoxide, or DMSO, as a home remedy. This gel, which smells like garlic and shines like oil, was used as a kind of anti-inflammatory. Her renal failure would have prevented her from eliminating it from her body, and thus the paramedics, upon providing oxygen, could have converted the DMSO into dimethylsulfone, also known as DMSO2, which crystallized in her blood. Then, the defibrillation would have generated a reaction that transformed it into dimethyl sulfate, that is, DMSO4, a highly toxic gas. And so, upon being released into the air, it intoxicated the staff. This theory became the one officially accepted by the Riverside coroner and is a topic of forensic medicine books even to this day. The family of Gloria, however, rejected it completely. They pointed to errors in the autopsy and the handling of her organs that prevented reaching a clearer conclusion. Her body was held for more than 10 weeks before being released to the family. Health authorities considered that it could represent a biological risk, so it was isolated and subjected to special protocols. During that time, several autopsies were performed, one by the county coroner, another by an independent team, and one more by the California Department of Health. The results were contradictory, and some organs, including the heart, were destroyed during the analyses, which provoked the indignation of her relatives. The isolation, the delay, and the storage conditions caused the body to decompose rapidly, and when it was finally released, it was in an advanced state of deterioration and was buried in an unmarked grave at the Hollywood Memorial Park in Riverside. Gloria Ramirez was nicknamed the Toxic Lady, and her case has been told in an infinity of documentaries, mystery programs, and YouTube channels. Although many tend to overlook the scientific explanation which, at least for us, does not take away the impact of this story, since the series of events that occurred remain deeply disturbing. Karolina Olsson, the Sleeping Beauty of Oknö. On the island of Oknö, off the eastern coast of Sweden, lived Karolina Olsson, born on the 29th of October 1861. She led a quiet and perfectly normal life with her family, at least until a cold February afternoon in 1876, when she was 14 years old. That day, while walking back from school, Karolina slipped on the ice and hit her head. After getting up, without further inconvenience, she continued her way and got home. 4 days later, she complained of a strange toothache. Her family, who were simple and superstitious people, like many in rural Sweden in those years, murmured that maybe it could be witchcraft. The only thing they did was send her to bed to rest, since surely the next morning she would feel much better. But the next morning, Karolina did not wake up. She was not dead, she was only asleep. But no matter how hard they tried, they could not make her wake up. Hours, days, and weeks passed, and she could not wake up. Her father, a humble fisherman, did not have the resources to pay doctors, so they resorted to the town midwife and the advice of neighbors. Her mother began to feed her by force with milk mixed with sugared water. She did this by the spoonful so that she would not die. When she was finally checked by a doctor paid for by the neighbors, he wrote in a Scandinavian medical journal, asking for help from his colleagues, as he had never seen a similar case before. There were somewhat strange details about Karolina's sleep. Her hair and nails barely seemed to grow from time to time. The girl occasionally sat up slightly and murmured things, mostly nursery prayers learned by heart. In 1892, 16 years after falling into that sleep, she was admitted to the Oskarsham Hospital, where she was subjected to electroshock therapy. But Karolina did not even react to that. She was discharged on the 2nd of August 1892, without improvement, and so Karolina returned to her home in Oknö. In 1904, her mother died, and her family hired a caregiver to take charge of the house and the care of Karolina. A year later, when one of her brothers died, Karolina, motionless and without opening her eyes, began to cry as if she were conscious of what was happening around her. On the morning of the 3rd of April 1908, her caregiver heard thuds and sobbing in the room upstairs. She ran up and found Karolina standing, unsteady, crying, and with pale skin, her eyes dazzled by the light. 32 years and 42 days had passed since she went to bed for that toothache. When her brothers arrived, she did not recognize them. They were all adults now. She could barely speak. She found it hard to articulate words. However, in a matter of days, she showed something impossible. She still knew how to read and write perfectly. She remembered without stumbling what she had learned in school, and her face, in fact, seemed that of a woman in her 20s and not 46 as she was at the moment. The news spread across Europe and reached the United States. In Stockholm, psychiatrists examined her and concluded that she retained the same faculties as before the lethargy. The case also attracted the attention of Harold Frodin, a psychiatrist with a skeptical gaze, who visited her in 1910 and 2 years later published a study on her case. In this, he made it clear that no one can sleep for decades without starving to death. His hypothesis was that Karolina suffered from prolonged catatonic stupor, interrupted by occasional awakenings of pain, sorrow, or rage, and that the family dynamics, such as her overprotective mother, maintained this involuntary staging. Basically, what he explained is that Karolina's condition was not physical, but mental, and that she unconsciously decided to evade the world, taking advantage of her mother's overprotection. An explanation that has divided the opinions of both the public and the medical community. Karolina Olsson did not fall into a similar sleep again. In fact, she lived discreetly in Oknö until her death on the 5th of April 1950, at 88 years of age. The story of the Sleeping Beauty of Oknö has survived time, becoming an enigma not only of medicine, but of history itself. Phineas Gage, the man with the iron bar, on the 13th of September 1848, in Cavendish, Vermont, a young railroad foreman named Phineas P. Gage, barely 25 years old, became, without intending to, one of the most famous patients in the history of medicine. Gage was known as a competent, responsible, and respected worker by all his companions. That afternoon, he was supervising the blasting of a rocky section to open the way for the Rutland and Burlington railroad tracks. His task consisted of filling a hole with gunpowder, adding sand, and compacting it with a metal bar to prepare the detonation. This bar measured 1.1 meters long, 3.2 centimeters in diameter, and weighed about 6 kilograms. In addition, it was pointed at one end. The accident happened in just an instant. According to testimonies, Gage was distracted and did not place the sand before tamping the load, and so, the friction of the bar directly against the gunpowder produced a spark, which led to an immediate explosion. The heavy bar was shot out like a cannon projectile, entering through Phineas's left cheek, passing through his skull behind the eye, and exiting through the top of the skull, landing several meters away, stained with blood and brain tissue. The workers were paralyzed with horror. Nobody could survive something like that, but Gage did not die. In fact, he never lost consciousness. For just seconds after the explosion, he fell backward convulsing, but immediately began speaking clearly, asking for help. They moved him in a cart to the town hotel, and there he waited for the doctor. When Dr. John Martin Harlow, the main clinical witness of the case, arrived at the place, Phineas received him sitting in a chair, and with the calm of a man who had just cut his finger, he said, "Doctor, here is business for you." He had his face covered in blood, his left eye destroyed, and an open wound that showed part of his brain. But this man remained lucid. Harlow cleaned the wound as he could, stopped the hemorrhage, and applied dressings. In the following days, Gage developed fever, delirium, and infection. But against all odds, he did not die. In less than 2 months, the man pierced by an iron bar of more than 1 meter was already walking, talking, and apparently completely recovered. His case was reported in medical and scientific journals. It was spread as a medical miracle that no one could explain. However, the strangeness did not remain only there, for the friends and relatives of the man began to notice that Gage was no longer Gage. Before the accident, he was described as a cordial, responsible, and balanced man, but now he was irritable, impulsive, rude, and even blasphemous. He showed outbursts of anger, could not organize long-term plans, and seemed completely incapable of maintaining discipline in his work. His personality had changed radically. These changes, documented by Harlow and other witnesses, became the first scientific evidence that the frontal lobes of the brain are related to personality, decision-making, and the control of emotions. After recovering physically, Gage exhibited himself for a time at fairs and traveling museums along with the bar that almost killed him, charging admission to those who wanted to see him. And later, around 1852, he traveled to Chile, where he worked for several years as a stagecoach driver, a job that required great physical and mental skill. In 1859, he returned to the United States to live with his mother and sister in San Francisco, but his health from this point began to deteriorate. On the 21st of May, 1860, after suffering a series of epileptic seizures related to his old injury, Phineas Gage died at 36 years of age. His body was buried in the Lone Mountain Cemetery, although years later Dr. Harlow recovered his perforated skull and the famous iron bar. Both are kept to this day in the collection of the Warren Anatomical Museum, which has no relation to Ed and Lorraine Warren, at Harvard University, where they are contemplated by thousands of students and visitors as relics of one of the most extraordinary episodes of medicine. The case of Gage is already a classic in all neurology classes, for it proved that a devastating wound to the brain can not only not be fatal, but also fundamentally alter what makes us, deep down, who we really are. Brooke Greenberg, the girl who didn't age. Brooke Greenberg was a girl from Baltimore, United States, who became a living enigma for modern medicine. When Brooke was born in 1993, nothing made one suspect anything out of the ordinary. She was a premature baby, small, weighed around 1.8 kilograms, and had a hip problem that required surgery. But after that, she seemed to recover normally. Her parents, Melanie and Howard, took her home with the hope of seeing her grow up healthy. They had other older daughters and, like any family, expected Brooke to grow at her own pace. However, that pace stopped almost completely after her first year of life. While her sisters continued to grow, Brooke remained trapped in the body of a baby. By the age of 4 or 5, Brooke had barely grown a little more than at birth. and then she simply stopped growing completely. Her parents realized that something was wrong. Their daughter continued to have the appearance and needs of a baby of months, although she was already a preschool-aged girl. Brooke never learned to speak. She kept her baby teeth without permanent teeth growing in, and she needed diapers and care like those of an infant. When she was 16 years old, she measured about 76 centimeters and weighed 7 kilograms, similar to a child of a year and a half. Brooke's parents made pilgrimages through countless specialists looking for answers: pediatricians, endocrinologists, geneticists, but no one found the cause of her condition. All the exams came out normal. Her DNA showed no known anomalies. Her chromosomes were those of a common girl. The doctors were baffled. They had never seen a similar case before. Faced with the lack of a diagnosis, researchers began to call Brooke's case Syndrome X, basically acknowledging that it was a completely unknown syndrome. Meanwhile, Brooke faced other health problems. She had to be fed by a tube because her esophagus was so small that solid food could obstruct it. She suffered from multiple medical crises throughout her life. A few years later, she had a stomach ulcer, later an episode similar to a stroke, and on one occasion, doctors even detected a tumor in her brain. But to everyone's surprise, when they were going to treat that tumor, it had disappeared inexplicably. Every year that passed, Brooke remained with the mind and body of a baby. She smiled, made sounds, but did not articulate words or show mental development according to her age. She was affectionate and enjoyed children's music. Her parents loved her just as she was. Although it was difficult, they said that for them, Brooke was fine that way. There had to be some reason for her special existence. Against all odds, Brooke Greenberg lived until she was 20 years old, passing away in 2013 due to pulmonary complications, without having ever grown or aged. Her death was a hard blow for her parents and relatives, but it also left many questions for science. Researchers from prestigious institutions such as Johns Hopkins Hospital and Mount Sinai Hospital studied her case even after she passed away. The great hope was that Brooke perhaps hid among her genes the key to eternal youth, that perhaps in some way her body had its biological clock turned off. If this secret had been discovered, perhaps it could be better understood why we age, or how to treat age-related diseases, such as Parkinson's or Alzheimer's. Unfortunately, until now, that answer has not been found. Geneticists did not find obvious mutations that explained her unique condition. Syndrome X remains the name for this condition about which practically nothing is known, but that if ever managed to be deciphered, it could change the world forever. Stan Larkin, the man with the heart in a backpack. Stan Larkin was an athletic teenager from Michigan with a great passion for basketball. In 2007, when he was just 16 years old, during a game, he collapsed without warning. At first glance, it seemed like a simple fainting spell, but subsequent studies revealed a devastating sentence. Stan suffered from familial dilated cardiomyopathy, a genetic disease that enlarges and weakens the heart until it is left incapable of pumping blood. As it was a condition that could be hereditary, the whole family had studies done, and it was discovered that his brother Dominic also suffered from it. In a matter of years, his heart muscle had aged like that of an old man. The doctors had been clear. The only real solution was a heart transplant. The problem is that transplants do not arrive quickly. They can take months or years on the waiting list, and Stan no longer had time. By 2014, his heart was too damaged, and every beat was already insufficient. Doctors at the University of Michigan, led by Dr. Jonathan Haft, decided to try something that until that moment had been tested few times outside of a hospital: the use of an artificial heart. In November 2014, the surgeons opened his chest, completely extracted the diseased heart, and in its place connected a mechanical device that assumed the function of pumping blood. The syncardia, which was the name of the device, was composed of 2 plastic chambers that acted as artificial ventricles, moved by compressed air that entered through tubes in his abdomen. Due to its size, it could not stay inside the body. The machine that made it work had to be on the outside, inside a backpack that weighed 6 kilograms. In that backpack with batteries and pneumatic pumps was now his new source of life. Since then, Stan lived something that seems like science fiction, surviving without a heart inside his chest. The apparatus pumped about 9 liters of blood per minute, enough to keep him conscious, moving, and energetic. At first, he confessed that he felt a constant fear, sleeping with the backpack next to him, showering, walking down the street. Any failure would mean his instant death. But little by little, he learned to trust that mechanical hum and the artificial heartbeat that accompanied him every day and every night. The surprising thing is that this was not limited only to surviving. He returned to practice sports with his friends, walked, drove, and led a fairly active life. For 551 days, that is, 17 months, Stan lived with the backpack glued to his back, functioning as his vital motor. The case attracted worldwide attention. The image of a thin boy with tubes coming out of his torso and a backpack on his back containing his heart seemed taken from a futuristic novel. Finally, in May 2016, the call he was waiting for arrived. A compatible donor was available. Stan was subjected to a new surgery to receive a real biological heart. The transplant was successful, and barely 2 weeks later, he said he felt stronger than ever, with renewed energy, without having to carry the backpack that had been his life support for almost a year and a half. The case of Stan Larkin was registered as one of the most extraordinary in modern cardiology. Until then, many patients with artificial hearts were condemned to remain connected to huge machines inside hospitals. But Stan showed that it was possible to live outside, play, laugh, hug the family, and even make a basket on a court with a plastic heart that was hanging on his back. And in case you are wondering, his brother also managed to get a heart transplant and did not need to carry a device like Stan's. This case, unlike the others we have presented, is not about an ailment, a strange accident, or an inexplicable condition, but about an impressive story about what modern medicine has managed to do. And taking advantage of the subject, if we can use the reach of our humble mystery channel for this, we would like to remind you of the importance of being an organ donor, because your heart could save someone else's life when you no longer need it.